World Elder Abuse Awareness Day is recognized on June 15th annually. The Ministry of Health, Wellness and Elderly Affairs uses this opportunity to highlight the challenges faced by older persons around us and to renew our commitment to ensuring accessible health care and support for their well-being. This day of recognition was launched by the International Network for the Prevention of Elder Abuse and the World Health Organization at the United Nations in 2006 and remains an important observance to remind us that we need to protect our older generation from abuse and neglect. World Elder Abuse Awareness Day supports the United Nations International Plan of Action that acknowledges the significance of elder abuse as a public health and human rights issue. By shining a spotlight on this form of abuse, we are encouraged as a nation to take action and support justice for older persons. As we make the commitment to take responsibility to prevent the abuse of older persons, we can lend a hand to those in need, be their voice when they need it, and take actions to protect them. In accordance with this year's theme, let us look beyond age and put effort into changing the conversation about aging. The government of St. Lucia is committed to changing the conversation about aging as we encourage families, communities, and schools to understand that aging is a lifelong process. We should not wait till we are 65 years or older to address aging issues. Preparation for old age begins when we are young. It begins with making healthy choices in our earlier years, making good choices about the foods we eat, the activities we engage in, and the financial decisions that we make. With the right approach to planning for older age and our government's commitment to making health and wellness services accessible, affordable, and effective, we can grow healthier, stronger, and more independent in our later years. As the Minister for Health, Wellness, and Elderly Affairs, I confidently state that my ministry is making every effort to change the conversation for the benefit of our older persons. As part of that conversation of change, all programs implemented by the ministry are carried out to benefit all citizens, including older persons. Persons diagnosed with diabetes and hypertension receive their medication free from public health facilities. The 80+ program continues to benefit our older citizens where they receive all available medical services free at primary care government facilities. We are working to expand the range of services available to our older population. As universal health coverage is being rolled out, we will continue to strengthen health services and make them more accessible, and through the newly implemented Elderly Affairs Unit at the Ministry of Health, Wellness and Elderly Affairs, we are developing a national policy for older persons which will provide a holistic guide to managing the issues of aging. I take this opportunity to express gratitude to the various ministries and organizations such as the Ministry of Equity, Social Justice and Empowerment, National Insurance Corporation, the National Councils of and for Older Persons, the St. Lucia Pensioners Association, community-based organizations like the Club 60s and Mothers and Fathers groups, the Home Care Program of the St. Lucia Social Development Fund, and the many faith-based organizations and charitable groups who have been integrally involved in the conversation of healthy and active aging. Let us as a country continue to change the conversation about aging as we look beyond age and commit to making it a practice to treat our older persons with care, love, respect, and dignity. Let us stop elder abuse and encourage our older persons to age safely and comfortably.